101. When performing a sterile dressing change, what is the nurse's priority action? Answer: open the sterile supplies using sterile technique. Explanation: sterile technique must be used to avoid contaminating the supplies and the dressing, reducing the risk of infection. 102. Which of the following is a priority for preventing the spread of respiratory infections in a hospital setting? Answer: implement droplet precautions for symptomatic patients. Explanation: droplet precautions prevent respiratory pathogens from being transmitted through droplets when a patient coughs or sneezes. 103. What should a nurse do to prevent infection transmission when caring for a patient with a gastrointestinal infection? Answer: implement contact precautions and perform hand hygiene frequently. Explanation: contact precautions and frequent hand hygiene reduce the risk of transmission of gastrointestinal pathogens. 104. What is the most important action when handling linens from a patient with a contagious infection? Answer: place the linens in a designated, labeled laundry bag. Explanation: using a designated laundry bag helps contain and prevent the spread of infectious material from the linens. 105. What should a nurse do if a patient on isolation precautions needs to use the restroom? Answer: assist the patient in wearing a mask and ensure proper hygiene is followed. Explanation: masking the patient and ensuring hygiene reduces the risk of spreading infectious agents outside the isolation room. 106. Which of the following actions should be taken when cleaning a hospital room after a patient with a contagious infection has been discharged? Answer: perform terminal cleaning of the room using a disinfectant. Explanation: terminal cleaning with an effective disinfectant kills pathogens that may be left on surfaces after the patient leaves the room. 107. How often should an N95 respirator mask be replaced? Answer: when it becomes soiled, damaged, or difficult to breathe through. Explanation: an N95 mask must be replaced to maintain its efficacy in filtering airborne particles and to avoid exposure to infectious agents. 108. A patient with a urinary tract infection, UTI, requires catheterization. What infection control measure is most important? Answer: use sterile technique during catheter insertion. Explanation: sterile technique is critical to avoid introducing pathogens into the urinary tract during catheter insertion, reducing the risk of a healthcare-associated UTI. 109. What action should a nurse take if they suspect a patient is developing a healthcare-associated infection, HAI? Answer: notify the healthcare provider and initiate appropriate infection control precautions. Explanation: early identification and timely intervention help prevent the spread of HAIs and reduce the risk of complications for the patient. 110. What should a nurse do if they suspect an outbreak of influenza on the unit? Answer: implement droplet precautions and notify the infection control department. Explanation: droplet precautions are necessary to prevent the spread of influenza, and notifying infection control ensures that appropriate measures are taken. 111. When should a healthcare worker wear gloves when interacting with a patient? Answer: when there is a potential for contact with blood, body fluids, or contaminated surfaces. Explanation: gloves provide a barrier to protect healthcare workers from potential exposure to infectious agents. 112. What is the most effective way to prevent the spread of infection in a healthcare setting? Answer: consistently perform hand hygiene. Explanation: hand hygiene is the most effective intervention to prevent the transmission of infections in healthcare settings. 113. What is the priority action when preparing to care for a patient with a known infectious disease? Answer: review and follow the infection control protocols for the specific disease. Explanation: disease-specific infection control protocols are designed to minimize the risk of transmission and protect both patients and healthcare workers. 114. Which of the following is a necessary infection control measure when providing wound care for a patient with a draining abscess? Answer: use a sterile dressing and clean the wound with aseptic technique. Explanation: using sterile and aseptic techniques reduces the risk of introducing additional pathogens into the wound. 115. What should a nurse do if a patient is suspected of having an airborne transmitted disease, such as tuberculosis? Answer: place the patient in a negative pressure isolation room. Explanation: a negative pressure room helps prevent the spread of airborne pathogens by keeping air from escaping the room. 116. What should a nurse do if they witness another healthcare worker not following infection control protocols? Answer: address the issue immediately and report it to the supervisor. Explanation: reporting and addressing infection control breaches ensures patient safety and promotes adherence to safety standards. 117. Which of the following is the most important practice to prevent the transmission of Clostridium difficile, C. difficile? Answer: washing hands with soap and water after caring for an infected patient. Explanation: alcohol-based hand sanitizers are not effective against C. difficile spores, so soap and water are necessary for effective hand hygiene. 118. A nurse is caring for a patient with MRSA and a wound. What is the most important infection control practice? Answer: implement contact precautions. Explanation: MRSA is transmitted through direct contact, and contact precautions prevent the spread to other patients or healthcare workers. 119. What should a nurse do to reduce the risk of infection when administering an injection? Answer: clean the injection site with an alcohol swab. Explanation: cleaning the injection site with an alcohol swab helps reduce the risk of introducing pathogens during the injection process. 120. What is the best infection control practice when disposing of a patient's used syringe? Answer: place the syringe in a designated sharps container. Explanation: sharps containers are designed to safely contain needles and syringes, preventing injuries and the transmission of infections. 121. A nurse notices that a patient with an indwelling catheter has developed fever and chills. What should the nurse do first? Answer: assess the catheter site for signs of infection and notify the physician. Explanation: fever and chills can be signs of a urinary tract infection, and early identification of infection helps prevent complications. 122. What is the most effective way to prevent surgical site infections? Answer: administer prophylactic antibiotics as prescribed and maintain a septic technique. Explanation: prophylactic antibiotics help prevent infections, and a septic technique reduces the risk of contamination during surgery. 123. What is the first action when caring for a patient suspected of having a viral infection that is spread via droplets? Answer: implement droplet precautions and notify the healthcare provider. Explanation: droplet precautions, such as wearing a surgical mask, reduce the risk of transmission of the infection through respiratory droplets. 124. A nurse is preparing to enter a patient's room on contact precautions. What PPE should be worn? Answer: gloves and gown. Explanation: contact precautions prevent the spread of infection through direct contact with infected materials, so gloves and a gown are required. 125. What should a nurse do if they are unable to remove a contaminated gown without touching the outside? Answer: have another healthcare worker assist in removing the gown. Explanation: it is important not to touch the outside of a contaminated gown to avoid cross-contamination. A second person may help safely remove it. 126. What is the most important infection control measure when caring for a patient with a respiratory infection? Answer: implement droplet precautions. Explanation: respiratory infections are often spread through droplets when the patient coughs, sneezes, or talks, and droplet precautions prevent transmission. 127. Which of the following should the nurse do first before starting an intravenous line in a patient with a suspected infection? Answer: perform hand hygiene. Explanation: hand hygiene is the most important step in preventing the introduction of pathogens during any procedure, including for insertion. 128. When caring for a patient on airborne precautions, what should a nurse wear? Answer: a fitted N95 respirator mask. Explanation: airborne precautions require an N95 respirator mask to filter out smaller infectious particles that may be airborne. 129. A nurse is performing a dressing change on a wound with purulent drainage. What should the nurse do to maintain infection control? Answer: use sterile technique during the dressing change. Explanation: sterile technique ensures that no additional pathogens are introduced into the wound during the procedure, reducing the risk of infection. 130. What is the first step in infection control when receiving a patient from the emergency department with suspected meningitis? Answer: place the patient in a private room with droplet precautions. Explanation: meningitis can be spread through respiratory droplets, so the patient should be placed in a private room with droplet precautions to prevent transmission. 131. How should a nurse dispose of used disposable gloves after caring for a patient in isolation? Answer: place the gloves in a designated biohazard waste container. Explanation: used gloves should be discarded in a biohazard container to safely dispose of potentially contaminated materials. 132. A nurse is caring for a patient with a Clostridium difficile infection. What should be prioritized when providing care? Answer: practice thorough hand hygiene with soap and water. Explanation: alcohol-based hand sanitizers are ineffective against C. difficile spores, so thorough hand washing with soap and water is essential to prevent the spread of infection. 133. What is the most important action when removing a surgical mask after caring for a patient on droplet precautions? Answer: perform hand hygiene after removing the mask. Explanation: after removing a mask, performing hand hygiene prevents contamination from any pathogens that may be on the mask or hands. 134. A nurse is caring for a patient on isolation precautions for a contagious disease. What should be done to prevent cross-contamination? Answer: ensure dedicated equipment is used for the patient and disinfect equipment between uses. Explanation: dedicated equipment prevents the spread of infection, and disinfecting shared equipment reduces the risk of transmission. 135. Which of the following is an appropriate action when cleaning a surface contaminated by a patient with a gastrointestinal infection? Answer: use a disinfectant that is effective against gastrointestinal pathogens. Explanation: using a disinfectant that is proven to kill specific pathogens, like those causing gastrointestinal infections, ensures proper cleaning and decontamination. 136. What should a nurse do if a sterile dressing becomes contaminated during the dressing change? Answer: discard the contaminated dressing and use a new sterile dressing. Explanation: if the dressing becomes contaminated, it should be discarded immediately and a new sterile dressing should be used to prevent infection. 137. What is the correct procedure for cleaning and disinfecting a contaminated room after a patient with a contagious disease has been discharged? Answer: perform terminal cleaning using an EPA-approved disinfectant. Explanation: terminal cleaning ensures that all surfaces are disinfected thoroughly using a cleaning agent effective against the infectious agent. 138. What is the most important infection control measure when handling body fluids? Answer: always wear gloves and perform hand hygiene after removal. Explanation: gloves provide a protective barrier, and hand hygiene after removing gloves helps prevent the transmission of pathogens. 139. What is the priority infection control measure when handling linens from a patient in isolation? Answer: place the linens in a designated, labeled laundry bag without shaking them. Explanation: placing the linens in a designated bag without shaking them prevents the spread of infectious particles into the air. 140. When should a nurse replace a surgical mask while caring for a patient in droplet precautions? Answer: replace the mask when it becomes moist or damaged. Explanation: a mask that is moist or damaged may not provide adequate protection against pathogens, so it should be replaced promptly. 141. A patient with a fever and respiratory distress is admitted with suspected pneumonia. What infection control precautions should the nurse implement? Answer: implement droplet precautions and monitor for changes in respiratory status. Explanation: pneumonia can be transmitted through respiratory droplets, so droplet precautions are needed to prevent the spread of infection. 142. Which of the following should the nurse do before inserting an indwelling urinary catheter? Answer: perform hand hygiene and use sterile technique. Explanation: hand hygiene and sterile technique are necessary to reduce the risk of introducing pathogens during catheter insertion. 143. What should a nurse do if a patient in contact precautions has an unplanned transfer to another unit? Answer: ensure the patient is wearing a gown and gloves and that the isolation protocol is maintained. Explanation: Maintaining isolation protocols during transport ensures that infectious agents do not spread to other areas of the hospital. 144. What should be done to prevent the spread of infection when a patient on isolation precautions needs a procedure done in the hospital? Answer: ensure the procedure area is cleaned and disinfected after the procedure. Explanation: proper cleaning and disinfecting of the procedure area reduces the risk of contamination for other patients and healthcare workers. 145. When caring for a patient with a wound infection, what is the best way to maintain aseptic technique during dressing changes? Answer: use sterile gloves and supplies and avoid touching the wound directly. Explanation: using sterile gloves and supplies and avoiding direct contact with the wound helps prevent contamination and infection. 146. A nurse is assisting a patient with the removal of a urinary catheter. What infection control step is essential? Answer: perform hand hygiene before and after the procedure. Explanation: hand hygiene before and after the procedure reduces the risk of introducing or spreading infection. 147. What is the first action to take when a nurse is exposed to blood during patient care? Answer: wash the affected area with soap and water immediately. Explanation: washing the affected area promptly with soap and water helps minimize the risk of infection transmission after exposure to blood. 148. What is the most effective method for preventing the transmission of influenza in a hospital setting? Answer: implement droplet precautions for symptomatic patients and encourage staff vaccination. Explanation: droplet precautions prevent the transmission of influenza through respiratory droplets, and vaccination reduces the risk of healthcare worker exposure. 149. A nurse is caring for a patient with an indwelling catheter who develops a fever. What is the most appropriate action? Answer: assess for signs of catheter-related infection and notify the healthcare provider. Explanation: a fever may indicate an infection, and early assessment and treatment can prevent further complications. 150. What should be done to prevent the transmission of infection when using patient care equipment, such as thermometers and blood pressure cuffs? Answer: clean and disinfect the equipment after each use. Explanation: cleaning and disinfecting patient care equipment ensures that pathogens are not transferred between patients.